the COVID-19 Transparency and Accountability Project has been working for 2.5 years now, and it has been a great collaboration. It has been a collaboration between the main partners or the lead partners that are Connected Development from Nigeria and Budget from Nigeria, and a Global Integrity, and work with awesome partners doing the heavy lifting across countries in Africa, across 9 countries. Those are Cameroon, Ghana, Kenya, Liberia, Malawi, Nigeria, Senegal, Sierra Leone, and Zimbabwe. And we have several of them presenting here and others attending. It would be great to hear their experience, hear the struggles that they have gone through, and all the things that they have been able to achieve. And it's also important to note that this project has had a really interesting evolution throughout the years. It started as a rapid response to the COVID-19 pandemic, making sure that people knew what money was spent and in what the money was spent to respond to a pandemic. So a civil society led efforts to increase transparency and really try to achieve accountability about the spending of those resources, making sure that they were used for the best purposes. And now it has evolved into a more collaborative model, bringing citizens and governments together to strengthen health systems. We have been able to build a network, more than 300 organizations, including government, community-based organizations, national level organizations, and media. And the partners have been doing a great work. So I really don't want to extend my participation. Just know that we from Global Integrity have been really happy and proud to be part of this collaboration and to be able to support our country partners as they do work, learn from the experience of others, and share those lessons and build the capacity of movements in each country. And we have today several people. We have Mukhtar Modibo from Connected Development, who will be facilitating the event. We have Ijan Nulowa from Budget, who will be doing some final reflections. And we have the panelists, who are Nancy Saibo from Actions for Development in Cameroon, Ev Matai from civic in Kenya, Amadou Sam from Budget Senegal, and Jennifer Moffat from Budget Ghana. Without further ado, I'll leave the word to you, Mukhtar, so you can take it on from here. Thank you all.
All right, thank you, Jorge. It's good to finally see some faces that we've been doing this amazing work together. So thank you for joining us. I'm joining from the northwest part of Nigeria, where I'm currently on field to meet some government guys around our advocacy in CTAP around the vaccine work we've been doing over time. So I want to welcome you all for joining this very great occasion where we'll be sharing our experience, as well as our anticipated successes, as well as the anticipated ones. And we'll also be listening to you, what you think is an update, or what you think, how you think we're going to collaborate and push CTAP to the next level, where we can be able to achieve what we want to achieve. Like Jorge said, my name is Mukhtar Modibo. I lead CTAP from the Connected Development side. And I'm happy to have Eve from Kenya join me on this, as well as Jennifer from Ghana, Nancy from Cameroon, and Amadou from Sierra Leone. So we're going to have a very good conversation in trying to understand how we started CTAP, and then where we are, how the journey has been, and what we think is going to be the next point of call for CTAP. So I will do it this way, right? Each and every speaker sort of have like 5 minutes to sort of share his or her own challenges as well as successes, but please make sure you try to explain that challenges as well as success to the understanding of people, so that we'll know. And immediately after that, we'll be launching the report so that people can check further to see what we've had over the time. So if Nancy is here, I don't think Nancy is here. Is Nancy here, Jorge?
Yes, she just joined and is getting to a panelist.
All right, so I think we can start with Eve. Eve is the country lead of Follow the Money and the programs director of CEDRAC. So if we can have you to just share how CTAP has been in Kenya, what were your success and challenges, as well as the anticipated ones and the unanticipated ones to our audience. If
Thank you so much, Mukta. Glad to see everyone, including the CTAP implementing partners from other regions of Africa. As Mukta said, my name is Eve Madhai, and I'm the country lead for Follow the Money here in Kenya, and also the CTAP lead. I also lead regional budget called the Nairobi Eastern and Central Regional Budget Hub. And I also lead an initiative called KE Budget Talk. I also sit at committee for Nairobi County, which is the capital city of Kenya, for the development of the next 5-year plan for the country. So I'll start from the onset. Just before, when COVID was striking the world, we start with the connected development lead, that is Hamza, and we predicted that it was going to be vital for us to gear up because we were already tracking government spending. It was wise for us to also track the resources that were raised for mitigating the impact of COVID-19. So we immediately got on board and we started formulating our activities, curating it to the context of each one of our countries. Because what happens, systems in Kenya are very different from systems in other countries. And so when that happened, we got going. First, we started with doing 2 research reports that was on health accountability, sort of a situation analysis to look at the legal framework of what the healthcare system provides for here in Kenya, and then vis-a-vis analyzing the mitigation strategies that were put in place to sort of cushion the less fortunate members of our society. Then we got to work. So we used this report. We went about different counties. We have 47 counties here in Kenya. We went around interviewing people in very remote areas to try and find out whether these palliatives that the government had put in place were actually reaching them. And to our dismay, many of them were not getting the necessary help that they were deserving at that particular point. So we decided to increase our advocacy. And one of the innovative ways we decided to go about it was to partner with community radios. At the moment, there are about 58 community media stations here in Kenya. So we realized that it was the best platform for us to kind of like have this conversation with persons living in informal settlements and rural areas. So through that, as CDREC, we were fortunate enough to partner with other CSOs like Code for Africa through their PESA Year 2 initiative. And we got to train 60 community media journalists who until today are using their platform to engage the public on the budget making process. So every time there's a policy document that has been put out for public participation, they reach out to us to sort of break down what the document means and how they can interact with their county governments to ensure that the people's voices are actually factored into those policy documents. So that's really worked well. Several have already initiated their own sort of budget talk type of conversations in their programs, and it has proved very instrumental as citizens are now able to create their own memorandum to interrogate and also to interact with government when it comes to these policy making processes. Then we also did the vaccine hesitancy research report, whereby we looked at the chain of distribution for vaccines from the depot, which is here in Nairobi at the airport, to the most remote areas, for instance, to Turkana County, which is a very marginalized area in the northern part of Kenya. So we were able to go into this community, actually visited through the partnership with the community radio stations. We went to a community radio station, which was very interesting because they speak their own vernacular language, which I also don't understand. So we went on air and the presenter actually had to interpret what we were trying to communicate to the public. And when they were asking questions, he'd interpret back and we'd be able to engage. So one of the issues that we came across was the language barrier. So this important vital information on how to prevent yourself from getting COVID-19 was being affected by the fact that not everybody speaks English or Kiswahili. So we were able to collaborate with key persons in those communities to be able to pass the message to the intended audience. Then another very critical thing that we're able to avert was the political roadblocks. Public participation has been very one-sided. It's just the government churning out information, and there's little to no space for feedback from the community. So we've been able to create citizen-led spaces through webinars, through social media, through our own platforms to consolidate feedback and information from the communities and relay this information to the government, which has been very instrumental. And from that engagement, we've been able to have at least 80 budget champions. Those are people who are advocating for monitoring budget implementation and also auditing how the government is utilizing public resources, and not just how it's utilizing the resources, but how are we raising those resources? Because one of the things that we found out is we had very good plans on how to ensure that everybody gets the necessary healthcare. But when it comes from, when the vaccines come from the depot to the county governments, there are issues that were involved on that level. For instance, a county like Kisumu County, which is on the western part of the country, once the vaccines got there, they had to transport the vaccines on motorbikes, which are normally referred to as boda bodas here in Kenya. So once you transport vaccines on a boda boda, you know, it's very essential to ensure that the vaccines get to the intended audience in the right condition. Do they have the necessary equipment to ensure that transportation of this vital medication reaches them in good time and it's still fresh and can be utilized? So that was one of the challenges. So we were able to advocate for proper allocation and timely distribution and allocation of resources to ensure that this can be managed well. Also, we were able to...
I don't want to cut you. We will definitely come back to you on that. I know you've done a whole lot, right? So 5 minutes will, whatever you try to push together, 5 minutes will not give you that time to try to extract. But I'll come back to you with another question. But I want to take Jennifer now. Now, Jennifer, I know a lot of things has happened in Ghana. And one of the instrumental things that happened in Ghana, Ghana was the first country that received vaccine in Africa. And, you know, aside that, when we come to the conversation around the health sector accountability, there was Abuja Declaration that sort of speak about the issue of 15% going to the health sector, as well as I know you've been doing a lot of things around the National Action Plan of the Open Government Partnership, right? So can you take us through the journey?
Thank you, Mukhtar. Thank you, everyone. I bring you greetings from Budget Ghana, and of course from my global director, Mr. Shimu Nigbinde, our international growth lead, Ms. Abiola, and of course, I know Iyano is on this call. Greetings, and my boss, that is Mr. Felix Anka, is also on this call, and everyone from the Budget family, I bring you greetings. So Mukhtar, you've already said most of it, but I also want us to take a little bit of a background for since our phase 3 for the CTAP project is also focusing on primary healthcare facilities. So it will interest you or everyone on the panel to note that Ghana has not less than 7,728 primary healthcare facilities across the country, which includes the community-based planning services, health planning services, which we normally call the CHIPS compound, which is the very first zone or interaction with most communities when it comes to health. Of course, we have our maternity clinics or maternity homes, polyclinics, and the clinics itself, and then health centers. And one of the major challenges when it comes to our health sector in Ghana includes accessibility, quality healthcare, infrastructure, medical equipment and supplies. And of course, most healthcare workers always refuse to go to parts of the country where they seem or perceive that the situation there is very dire. And so in that regard, you can see that these are some of a little bit of newspaper articles, which makes you ask the question whether these are really stories or the reality on the ground when doctors abandon their posts and refuse to go to places like the Upper East and Upper West, which is the northern part of the country. They also, doctors are now using their own phones to perform surgery, you know, and it's really funny when, not just funny, I think when I use funny, not in the funny sense, but looking at the situation itself, you ask yourself that why are these things going on when we say we've append our signature, government have made commitments with the Abuja Declaration and a whole lot of other things, and even to the Open Government Partnership. And that's one of the reasons why since November, the team in Ghana here has been over everywhere, both in-person meetings and on radio, talking about health sector accountability. We have engaged the OGP severally, and what we are trying to do is to get health sector accountability into the National Action Plan and come the 5th National Action Plan for Ghana. So when it comes to some of the innovative ways, we've realized that there's a lot of ways that we can, as citizens, we can engage citizens. And we realize that for us to really have a very collaborative decision-making, collaborative decision-making is actually one of the key things that we can actually use as OGP members, as CSOs, to implement change. And I'm glad that Budget Nigeria already have tracker, which we are actually advocating very much for them to implement in Ghana. Because on the tracker platform, both citizens and CSOs will be able to put their information out there, which collectively can be used to engage governments. Aside that, we keep talking about open data platforms where we are advocating that government, or even if it is a CSO-led process, we should have open data whereby most projects, and in this regard, we are looking at health projects, should be updated. Everyone should easily have access to those information. And out of that, both CSOs, government, and citizens will be able to use those data to make informed decisions. Aside that, over here in Ghana, I think for the past decade, there has been a lot of tech accelerators, but most tech accelerators are focused on entrepreneurship. So imagine if we are talking about citizen participation, citizen involvement, citizens knowing what is going on around them, which actually affects every sphere of life. We are believing that we should have civic tech accelerators, something that I think Budget Nigeria already have, which is the Civic Hive. And if we are able to implement something like Civic Hive in Ghana, we can imagine whereby people are being given the necessary information, knowledge, understanding, and then the expertise and know-how to go out there and engage. Because with this, if we are talking about open government, most of the things we are talking about is about engagement, getting citizens more involved in national issues. And we believe that civic tech accelerators is one of the options to go for. Also, we are looking at community-led budgeting. If we are talking that most of these budgets that governments expend is also for the community. So if community members are supposed to be the ones to access or to enjoy these benefits, then why not we do a bottom-up approach whereby community members are part of the decision making, they are part of the budgeting, they tell you exactly what they need in their communities, and then the government takes it up and implements it in the national budget. So that's one of the things we have also been holding talks on for a while now. And then we are saying that we also believe in Budget Ghana, some of the things we are working on is for us to have open government training programs. And for the budget team in Ghana, we are about training young people in different parts of the country where they will be able to understand what it means to be a community champion and how they can also effect certain changes in their community. So for innovation, these are some of the aspects we are looking at. These are some of the things we have worked on, and we are believing that over time, we'll be able to have the impact that we are looking for. So in navigating political roadblocks, we are looking at building strong relationships.
Sorry, Jennifer.
Hello? Can you hear me?
Yeah, sorry, Jennifer. Yeah, we can hear you. We can hear you, but I have to hold you a bit here, right?
Okay.
And I want us to have a conversation between myself, you, and Eve, right? Jorge, if you can bring back Eve, if she can on her camera so that people can see her, and let's have this conversation. I know in doing this, there is one peculiarity about these African countries, about us, right, is issues that has to do with government priorities, issues that has to do with government looking at what civil society organizations are doing, right? So in just few minutes, I don't have much time on this, in just few minutes, can you try to tell me how you navigate your conversation with government, and then how you're able to, put your own peculiarities in these ways? Let me start with Jennifer in this time, then
Okay.
I'll come if yeah.
Okay, Mukta, thank you so much again. So one of the things we did, engaging government is so difficult. And I remember we went for one of those meetings and we came back and I was really down, and I was on a call with our international growth lead, which is Miss Abiola, and then she was telling me that I'm really glad you are really going through this now, but these are some of the realities on the ground that you need to learn. And this is why I keep telling you, networking. And you can't achieve the success you want to achieve without networking, which is plain. So one of the things we realized, I think even our engagement with the OGP Secretary, the steering committee in Ghana recently, I think on the 30th of March, and one of the things I learned on that when I came back was that you should always have off-boardroom conversations. You shouldn't go there assuming everybody is going to buy into what you are saying. No, they are not. And it's made me understand something that I learned in political science when Harold Laswell said the policy process is about who gets what, when, and how. It's not just about you thinking you deserve it or it is a good cause, so you are going in for it. But it's about that conversations, literal conversations you have before the meeting itself, making conscious efforts to actually go and find out who is going to be on this meeting. Do I have a contact with any of them? Reach out to them, let them understand what you are doing and why there is a need for them to support you. So that's one of the major.
Thank you very much. Yes. One of the things I take from your own conversation is how deliberate you make effort and how systematic you make the effort in achieving what you want to achieve. I'll go to Eve now. Eve, I know we did a lot of things around tracking spendings of government, from tracking the funds that were allocated to the health sector, and then how you have been doing things around the budget talk. Would you want to give us, share some ideas or challenges and successes around that? But we don't have much time, so please let's do it sharp. Thank you.
First of all, you cannot advocate for something you don't know about. So that's why we were very intentional when going about the analysis of budgets, because in Kenya, we are known for having very good plans. In fact, a country like Rwanda has actually taken our policy documents and made them their own, and they've actually excelled in it. So what are we not doing? Our problem is implementation. So we decided to involve the public by formulating the regional budget hubs. And one of the things that we have been facing is accessing information, public information. Our government is not forthcoming when it comes to releasing budget information. How have we spent our money? Currently, we're actually trying to engage government to get them to give us implementation reports. Where are they giving the reports to the controller of budget, but they're not making these reports public? So what we have done with all our 80 budget champions, we actually send the same email to one person in government. When you see 80 emails in your inbox, surely you're going to respond. So that kind of bombarding them with those access to information requests has really worked well, especially in the coastal region. We have 4 regional budget hubs, so that we have actually collected ourselves, organized ourselves to engage government as a cohort of people who are very interested in knowing how our resources are being spent. And our whole idea is to ensure that those vulnerable persons who cannot speak for themselves, especially the PWDs and those who are PWD caregivers also, we've also incorporated them into our budget hub. And it's actually a regional budget hub for persons with disabilities specifically. So once that has been established, we intend to release them to be their own cohort, continue their engagement with government. Also, when it comes to the OGP, we have 47 counties, but only 4 counties are part of the OGP. Why is that? So considering that we have a new administration after last year's general elections, this is the right moment to engage the Council of Governors, because they are the key decision makers in their counties. They are the ones who can say we are going to join this or not. So that has really been instrumental.
Thank you very much.
Yes, thank you.
Thank you very much. I'll come back to you. I'm coming.
One more, a minute, seconds, 30
Yeah,
seconds.
I'll come to you now. I'll come to you now. You know, the best thing about the conversation in Kenya is the OGP head of Kenya during the last administration is the present president of Kenya now. So we expect to see more achievement.
Yes.
So coming back to Jennifer, this is your final thought on this before we come back, and then I'll get to Eve. I know we've been trying to build coalition, right? Now, coalition is one of the things that makes us achieve a lot of things during the CTAP project, right? And then doing it now. So what do you have to say around coalition, building partnership with government, civil society organization, community, and all that? And please put it in some of your final thoughts on this topic while we go to the next topic. Thank you.
Also, Mukhtar, so one of the things I want to say is for Ghana, we are currently implementing our 4th action plan. We are heading towards the 5th action plan, and there's nothing on health. Note, we have not had any commitments, not even one on health so far. So for us at Budget Ghana, we actually taking this health sector accountability very personal, and we are doing everything. So this is where it leads to how does coalition comes in? Because when it comes to OGP, you don't implement OGP in a vacuum. You don't do it alone. It has to be a group effort, a collaborative effort, people coming from different aspects, believing in a particular cause and then pushing it. So that is what we are doing now. Because apart from doing the off-boardroom meetings, calling people, meeting people, talking to people, emailing people asking you to come and pay homage to them because they are already in the system before you came in. What we are doing is we are now trying to reach out to people in our health space. So the CSOs, coalitions in health, SDGs in health, we are Commonwealth, we are with everyone and trying to let them know that the OGP is important, health sector accountability is important, making sure that all our primary healthcare facilities are functioning well, budget that is meant for them is being used for the purpose at which it was released. That is what we are working on. So thank you, Mukhtar, for having me.
Thank you very much. I'll definitely come back to you at some point if I have some time. So I'll take if we just have some minutes to go.
Okay, yes, some good news from Kenya. During this whole OGP engagement with government, we're currently implementing NAP 3, but we are formulating NAP 5. We are behind when it comes to, yes, we are behind when it comes to implementing the National Action Plan, and it's because of change of administration and other issues. But the CSO network is very, very strong in Kenya. I mean, I thank God for that. So once we got into that space, we were able to state our case on the importance of having health accountability as a component in National Action Plan 5. And it was very well accepted, and it's going to actually be incorporated in the National Action Plan 5. So it was the right moment to engage CSO network and also the government on that issue. And also, I mean, what Jennifer has really emphasized on the power of collaborating and being intentional on the people you're having these discussions with. They always say, if you can't beat them, join them. So what some of us have done, we've actually gotten ourselves into committees in county governments where we are also part and parcel of this decision making, because it's not enough to be a citizen and giving your views, but when you're part of the committee, you can actually ensure that the commitments that have been made, there's subsequent budgetary allocation to enable that particular aspect. So please get into these committees and advocacy.
Yeah, thank you. I know I'm cutting you people, but I'm coming back to you. I promise you, because I know this is a very good conversation we're having, and it's something that we have to, put it out there for people to understand. How deliberate we make effort in trying to achieve our partnership, and how systematic we follow the effort is something we're doing with between Ghana and Kenya. These are countries that are signed up to the Open Government Partnership. And we've been also doing a lot of things around trying to beat vaccine hesitancy, look into vaccine distribution, as well as vaccine equity. It's something we're big on that, and we're trying to achieve a lot of things. So I will leave this the way it is, even though Jennifer did not say, to Mukhtar, to Eve and other people when she was trying to bring greetings, but I forgive you at that. Then I'll come to
Mukhtar, I've seen a question about what I had said about Kisumu County transporting vaccines on a boda. It's because it was an urgent situation.
And answer. Please just note it down. We'll come back to question and answer so that we'll have something to this. So I'm going to go to the next point of call, where I'm going to have the two big guys now, Nancy and Amadou. It's always exciting to hear messages from Nancy's Cameroon and Senegal. It has always been a thing. Just a background story about the CTAP in Cameroon. It has always been something that we feel it's not going to happen, right? Because of the peculiarities of that very country. So first of all, I'm going to have Amadou from Senegal share his own ideas, innovative methods or ways they use in achieving CTAP in Senegal. Greetings from Nigeria. Let me have you.
Greetings. Thank you very much. Thank you very much, and thank you for all the panelists, Jennifer, Evelyn, and Nancy, and greeting for all our people in the Global Integrity, and Iano and the others attendees. So in Senegal, the context of COVID-19 came in a very difficult context about the health sector, because this was an actuality, because health was not one of the priority of the government. And if you see the budget that was dedicated to health, we have realized that COVID-19 has participated in bringing about much more effort of government in the health sector. So when COVID-19 started in Senegal in 2020, in March, the state government has set two plans with an amount of 1,000 billion CFA. So the first plan is social and economic resilience plan, and another plan of priority action plan with 3 sessions. The first session is maintaining jobs. The second session is supporting health. And the last one is distributing commodities, foods, and so forth. What we realized is only 30% of this money went to the health sector. So this has raised a lot of discussion in the country who wanted to fight against a health problem and putting all the money in companies and the others. We don't say it's not important, but health sector in Senegal was suffering. So that's why the civil society organization started gathering, and the CTAP project was one of those relevant actors, because CTAP has managed to gather the synergies of the civil societies. And what we wanted to do is everybody is doing things on his part. So why not try to have a synergy of action, working in monitoring all the funds that have been planned for the health sector. And therefore, we have our civil society and media engagement, because the media in Senegal, they consider themselves as civil society actors. So media and civil society have met 3 times in order to discuss and exchange about the action, so as to find one action to be done together. Therefore, we have been able to have what is called the advocacy note written and validated by everybody. And this led us to an advocacy plan in order to have an observatory for accountability in the health sector. And from now on, where I'm speaking, the ministry has got the file about the observatory, which have been supported by 14 most relevant civil society in Senegal working in transparency. And we are waiting, and we hope that we will have a good advancement in this project. And also, the next thing is community engagement and the local media engagement, because still, when we are working, we always try to engage media in what we are doing. And by doing so, we involve all the community organizations, and we have been able to go to 6 communities in Senegal, in the center, in the south, and because the health sector in Senegal is divided as a pyramid. They call it the health pyramid, where we have the central level with ministry and cabinet. We have the periphery level with the direction in the region, and the last one, which is the local level, where we have the health district. So we have been able.
Amadou, I'll come back to you. I'll definitely come back to you on that, because this is a conversation we ought to have. So I will rush to Nancy, right? Nancy, I know Cameroon has been a country where, you know, we always see impossibilities. And with the CTAP conversation, we always see you making impossibilities possible. You know, we've seen you, because of collaboration, we've seen the first Ministry of Public Health coming into a partnership with you, with ADE, and then we've seen how you were able to conduct some town hall meetings and what have you. And I know Cameroon is not signed up to the Open Government Partnership. And I know you try to do some things around signing up to the Open Government Partnership, and also some creating some coalition. So take us through the journey, the innovation, the journey, and then how you were able to get to where you are now. 5 minutes, Nancy. I know you have a lot. 5 minutes.
Thank you, Mukhtar. It's always exciting to talk about CTAP and our achievement and the challenges when we talk about Cameroon. Cameroon in Central Africa is this powerful nation with a very strong context, and everything is not news. So we are currently facing crisis in the Northwest, Southwest, and extreme North. So we have crisis before the COVID pandemic. So you can imagine 2 pandemics, 2 crises at the same time. So with the coming of CTAP project, it was a huge challenge, because talking about questioning, we don't have the culture of holding government accountable in Cameroon. It's still very small. So we had this challenge, first of all, bring citizens to know that they have the right to hold government to account. And we started holding like meetings in Yaoundé to first of all bring together civil societies organizations doing similar work like we do. So we don't do our things and they're doing a thing. No, bring it. Coalition is very important. That's one innovative approach I love about CTAP, because we make sure that we bring all of the stakeholders together to talk about the plan. So when we are taking action, government knows it is not just CTAP Cameroon or ADE, it's a whole lot of coalition of civil society, media, and also grassroots communities coming together to ask what's happening. So during the CTAP, first phase of CTAP, we had a research to know exactly how government used the COVID funds, and our advocacy was strong because I think that's our first success story. Because of the advocacy, the government had to start making ask the Supreme Court to investigate COVID funds. I think that was a huge success because we don't have that culture. So if we have that already, it's a plus. So the second one was, okay, we are still advocating for, okay, you've carried out the investigation. It is clear that there was misappropriations of funds, there was overbuilding, there was malpractices. So what is the next step? So we are currently working on that now. And with the crisis zone, we cannot focus on in other regions, because in Cameroon we have 10 regions. We cannot focus in other regions and leave the crisis zone. So it was a challenge for us to go to these regions where there's a crisis, and we have Amazonians that will basically tell you that there's ghost town, nobody moves. So we have our partners there, but we had to tell them, look, we have to respect their policy on ghost town, even if we have to do the work, because your safety comes first. But what we did is we worked with community grassroots organizations in these communities that could hold this meeting, because it was important that we heard how have they been managing COVID-19 in their community? What is that perspective? Because they are actually in the crisis zone, and this is COVID. COVID does not spare crisis zone. So we want to understand, how did you guys manage the COVID and the crisis? And believe me, the report was horrible, because the healthcare centers there, because that's what we did too. We had to research on the quality of primary healthcare centers in this region. So we make sure that any report we get from these different regions, because we visited 5 regions in Cameroon, we shared the report with the ministry. The ministry was not yet comfortable with us coming to tell them this is what is happening there, because they're like, okay, why are you doing that? Because they still have this tendency of feeling that we are always there to criticize. We're like, no, we are the voice of these people. We have come together as a coalition of organizations that want to see an improvement in the health sector. So we are bringing to you what these people face, because this is not just a report written from Yaoundé, but actually we've gone to the field to gather this information. I think they were impressed with that. Government was impressed with the fact that we are giving them concrete information through the research we've carried out. And we told them, okay, we want to work in collaboration.
I'm going to stop you here. And I know why I'm stopping you here, because this is going to bring together the next point of our conversation. So we're going to have conversation between you, Amadou, and myself, understanding the context of where you're coming from. I know, let me say, not based on research, but 75% of the people in your country only get to know one president, right? So, so a lot of political navigation had happened during COVID. I will want to know that journey. And I know the conversation of you not signing up to the Cameroon, not signing up to the Open Government Partnership, and what you're doing around building coalition. So I will throw it to Amadou now. I know conversation around the journey and then growth of building network and trying to bring people together to demand the health sector accountability, as well as think around navigation of the health sector in general, right? From the Abuja Declaration, like I mentioned earlier, to the general perception of health. What were the journey? And is Senegal signed up to the Open Government Partnership? I know some people are waiting to know. And what action plan are you doing? And then what are you going to, guys doing around inculcating health sector accountability into the action plan? I know this is a lot of questions, but in one minute.
No. So Senegal has signed the Open Gov partnership, and they participated even in the last event. And we have been able to discuss with the Senegalese OGP, because they have every year 21 engagement. And the job that we are doing is to have our problematics in their coming engagement for this year. And we are in discussion with them, because last year they had many engagement, but the health sector represented only one section about the people with disabilities. And we think for this year, we will have good advancement. Just the last thing about the government. In Senegal, the health ministry have many heavy process. Their process are extremely heavy. Even by writing a report, you have to be validated by the ethics committee of the ministry. And just making a report also, you have to write them a letter for questionnaire, send them, then they send you back. So this is very extremely heavy process. But now on and more we are working with them in order to be closer to them and trying to make things easy. But we have seen a lot of advancement more and more.
Yeah. So Amadou, when next you're going, I think you should take Mane. Mane can really help. The Mane of PSG. So I'll come to Nancy. I know there is a lot of political roadblock, but I don't want you to only focus on the roadblock. I want you to tell me how you navigate the roadblock, and also what you're doing to the what journey are you taking on the issue of Cameroon signing up to the Open Government Partnership and the coalition you're building. 1 minute, please.
Okay, so I'll just try to squeeze up things. So at the level of the OGP, we are still advocating for Cameroon to have the eligible scores to become a member of the OGP. We've joined since our launch in 2019. We've joined the civil society organization that have been leading these conversations. We've met the National Governance Partnership, which is in charge of making sure that we have the eligibility. But we shared with them some of the challenges or our review, because what we did is we called different organizations that are not even members of some of these working groups to give us what do they think can make us have the eligible scores. That is for the OGP. So we are still advocating for that in Cameroon. And for the roadblocks, you can Cameroon is a continent. That's how we call Cameroon. Cameroon is a continent on its own. And in Central Africa, I think the Central African countries are looking onto Cameroon. So a success for Cameroon is a success for Central Africa. And so what we are doing, we use town hall meetings. So the innovative approach was going down to this grassroots communities, organizing town hall meetings with community-based organizations and chief and religious leaders. So that when they give us this report or they give us their challenges, when we go back to Yaoundé and share this report, government will not only feel like it's an organization that is just coming up with reports, because they still feel like we're just there to criticize and not bring concrete solutions. So what we do is this report from the grassroots communities, and we add to them recommendations that have been given to them, or recommendations for the government, for the civil society, or for citizens themselves. So we go to them and say, this is what we've worked, this is our solution. So just in case they have their annual meeting or they have their plan of actions, they look at this recommendation, and this is going to be a win-win for us, because these communities are tired of seeing organizations come and go without concrete actions. So we are looking forward to concrete action based on our experience, based on this. So this is how we succeed to pass through that road, that we're using citizens as our key and as our power to get to the government.
Thank you. So if I try to put together what Nancy and Amadou tried to picture here, is the fact that we all understand our problems are enormous. We have a lot of problems in these countries, in this continent we call Africa, but with innovations and ideation, we try to bypass those roadblocks and try to make some impact. And I know one of the things we're trying to achieve, or one of the things we'll be focusing on in the next level of engagement with CTAP is to increase more footprint, is to build more capacities, to build more collaboration with media and community radios and what have you, so that we can get more influence, right? And we can share more innovative ideas on how to push health sector accountability. Thank you very much, Nancy, Amadou, Eve, and Jennifer. Now, I want all of you to come back to one place, because it's going to be another set of conversation, because I know our listeners have been listening and they might have a lot of questions they want to share with you, or their own ideas they want to share. So I have less than 10 minutes to do that, and then we call it a day. I know it's been an exciting journey sharing CTAP. That's why I keep laughing. Whenever we talk about CTAP, it makes me feel like, look at the impossibility. We think it was impossible, and we're making it possible now. So amazingly, we have amazing women leading the CTAP project. So whenever I talk about it, it makes me feel in one sort of way. So this is a point where we ask questions, right? If you have a question, I know there are some questions on the chat box. Isabel, will you want to help us read through those questions? And let's see, in 30 seconds, our speakers sort of answer them, and then we get live questions from the audience. Thank you, Isabel.
Of course. So there was one question from Chris Adwala, who actually raised his hand, so he can ask that question live. So let me just bring him on.
All right.
There you go, Chris. You can ask the question directly. Thanks.
Thanks a lot for this. My name is Chris Awala. I work with Community Initiative Action Group Kenya. I'm based in Kisumu City in Kenya. I wanted to know to what extent this Kisumu county government used the border in transporting vaccine. I have engaged with the government at different levels. So that I want, because it's a critical data. If you get me a particular information, I'll be able to link with the governor if there was a problem of that kind, such that we cannot the same things not reoccur. But to the best of my knowledge, I tend to think that might be a misinformation, because the way the vaccine has been handled, and I wanted to know when it was being carried the border, it was being carried from which center to where, and who carried this vaccine. Was he a health practitioner, or was it just somebody else that bought it and wanted to carry it for their own sake? But by and large, I wanted to make a voice also on I work on health accountability, and I've been on it for some times now. And I wanted to say that the biggest problem in our approach, NGOizing this thing, is that we look at what's supposed to be a movement into as programs, as projects. But I tend to think, provided there's no ownership, provided that we fly in and fly out, there will never be a concrete ownership by the community. Community must get access to information. Community must participate. Community-led approaches are the ones that will sustain the engagement. Because if you do this, all that we are doing here, and there's nowhere where the community voices are, and there's nowhere where communities sit and decide their destiny. I work on budget also. I do budget analysis. I look at auditor general reports, but I tend to think this meeting needs to be bigger than have more hours and bring more players, and so that we interrogate this data, because data, if it's not credible, then everything you say is mistrusted, and that's where the beginning of the problem. Thank you.
Yeah, thank you very much, Chris. I think so that we can have more people ask questions, you can also visit the website. We have a lot of data there, and then where you can engage us further. I will drop my email address and then the email addresses of the people here. If you have further questions, I'm definitely open to do this conversation with you. The website is www.covidfunds.org, right? So you can check. We have a lot of researches that we've done, almost 19 of them, right? You can check that and then put more on that. So if you have anything to add on his question, you can take it and then we take another question. Thank you, Chris.
Okay. I tried to answer the question in the Q&A chat box, but what had happened was there was late disbursement of funds from the national government to the county government. So the county health coordinator had to use her own means to ensure that these vaccines were getting to the most remote areas. That was before the disbursement of funds. That's where the challenge came in, but she found it very important to make sure that those vaccines reach those people. So that's why she used the boda, which was not the most ideal way to do things. That's why we brought out the question of the manner in which they are transporting these vaccines. I'm sure there are no cold storage facilities on a boda, but she just had to do that to ensure that people get the vaccines. And then since you're from Kisumu, I know you're aware of the Lake Region Budget Hub, and I'm so glad to see you here. I think I've encountered you in a meeting here or there, so feel free to also reach that hub. They're doing very well when it comes to monitoring the budget process in that area, that is the Lake Region. So I agree with you, it has to be citizen-led. That's why us in the budget fraternity, we are all very keen on sensitizing the public on how to track budget implementation and also carry out their own audits. So thank you.
Oh, thank you very much, Eve. Thank you. So Isabel, do we have any other question?
Yes, we do.
All right, let's go.
There's one from Kabina, given the experiences of COVID, and I know we're at time, so thanks for sticking with us. And the new report, by the way, is in the chat, so please grab it. But back to the question from Kabina, what would you say in the long term, what are the plans for effective preparedness in responding to any such pandemic? And if there's another pandemic like this, like COVID, are African governments ready with different responses based on the lessons learned here? Thanks.
Can I answer that?
Isabel, that's a big one.
Can I?
Please go ahead, please.
Okay,
But in 30 seconds.
Okay, so with CTAP, what we did is we did not only hold government to account, but we make sure that we research on the state of primary healthcare centers, because these are the people that will receive patients. So we want to make sure that government make sure these primary healthcare centers have the basic, because if they have the basic, we're not going to have a lot of cases. You get, so it's just to ensure, that's why we are still advocating for good primary healthcare centers, so that in case of future pandemic, these centers are ready to do what is the basic needs. We don't have to just wait for funds from IMF or other international bodies to make things work. For example, what is happening in Kenya, the transportation of these vaccines, because they had no funds and they were not prepared. Whereas if we are sure that, okay, these primary healthcare centers have what it takes to store these vaccines, what it takes to transport vaccines, or what it takes to make sure that maybe pregnant women or all of this individuals that come to have access, have the good quality. So we're not only advocating for transparency on COVID funds, we're also advocating for these primary healthcare centers to have the basic needs and best service delivery both from these different primary healthcare centers.
Yeah. So, thank you very much.
Add this one quick. This question came from Ghana, so we really want to add this one, a quick one. So, now one of the things you should look out for, and I am glad Nancy mentioned funding, is that the government of Ghana initiated the 1% COVID levy, which is also supposed to help us to prepare for the next pandemic. So we are not all that out of the game. We are still taking that money, putting it somewhere that in case there's another pandemic like we experienced, we just fall on that instead of waiting for donors to come and give us this or that and all the time. So thank you.
Thank you. Amadou, you want to say something? Go ahead.
Yes, just something about the vaccines. Since you were speaking about the vaccine, I think we need to have good communication and open framework at the national and the local level. Just as an example, here in the vaccine in Senegal, the government has not communicated well, because practitioners say for the vaccine we have first dose, and then after they come to have 2 doses, and then they come after to tell them every 6 months. If we don't have a good communication that is adapted and the framework at the local level that can help government communicate with citizens, I think that would be difficult to happen. Thank you.
Yeah, just to cap it all, I want us to understand one thing. In as much as in Africa, in Nigeria, and some other countries, we try to manage COVID in such a way that we never anticipated it. But I want you to also understand there is no management without resources. Now, the kind of resources we have for our health sector, I talked about the 15% of the funds going to health. And I think it's just South Africa that is doing up to 10%, right? And then if you come back to us in Nigeria, presently we're doing, I think, 4-point-something%, which is not enough, right? And over time, we've been trying to engage the people that have been doing this vaccine distribution, right? And then vaccine administration across the country. I will tell you this without questioning anything or mising word. There are some zones in the country that are yet to be paid their logistic allowances, their logistics or transport reimbursement for that. So are we ready for another pandemic? I will not want to say yes, no, but I think we need to also prepare. And that's why one of our basic recommendations around vaccine is, can we begin to develop or produce vaccine within the country? If you go to other parts of the world, you could see a country that has vaccine enough to vaccinate the entire country twice. And the only few countries, I think just 2 countries in Africa that was able to do 50% of vaccination across their people is Seychelles, and closely is Rwanda and some other part of the country. So these are things that we need to also put in mind, and also try and make it possible for us to be ready for another pandemic. We are not praying for it, but we have to also think around what we're doing around that. And that's why we're big on the health sector accountability and other aspects of health. Isabel, do we have any other question, or we call on Iyanu to give us his own remark and then close it up as our Oga Kwata Kwata?
I'm sure there are many questions, but we have answered all in the Q&A box. So let's close it up with Iyanu. Thanks everybody for your amazing insights.
All right, so Iyanu, let's have you.
All right, good afternoon, good morning from everywhere you might be joining us across the world and across Africa. Thank you very much for your time, for your attention, and also following the work we've done so far across the 9 African countries on the CTAP project. Thank you very much, Mukhtar, for hosting a very, very amazing conversation across the countries that we've had this project in the last 2 years. This work for us, it all started with just 1 country. I moved to 5 countries, moved to 9 countries, right? And for us, that's some level of progress. That's also from level of filling the gap of transparency and accountability, across the world.
So Iyanu, I think we can hear you.
Go ahead.
Yeah, we can hear you.
Can you hear me? All right.
Yeah,
so we've seen the necessity and the need for innovations like this, for interventions like this, because this helps us to understand how resources are being spent, and also to advocate for a proper and a general access for.
Did we lost Iyanu again? Iyanu, if you can hear us, we can hear you.
This opportunity and
we might need to have you, Mukhtar, to close up.
Yes. I think Iyanu is on field, likewise myself, and what he's trying to put, like I said earlier.
as well.
Go ahead, Yanu, go ahead. We could not hear you at some point, so go ahead. Sorry for the network.
No worries.
Yanu, if you can hear us, you can go ahead.
I can't hear you.
Oh, okay, so Yanu, I think we have to just let you go now. I know you're on field.
So can you hear me now? Can you
Yeah,
hear
we can
me?
hear. We can hear you now. Go ahead.
All right, so I'm just going to close it. We, Africa and the world, I don't think we have got preparing so much for another pandemic. We need to all of our healthcare resources, and also that's what our research work has done. The leg that we are on right now is consolidated campaigns across Africa, ensuring that people have an understanding of the work that we have done so far. All right, thank you very much for your time. Thank you very much for your attention. For your attention to us today. We really do appreciate, and we say a big thank you to you, and we can't wait to be with you physically again to engage you on the work that we are doing. Thank you very much, guys, and have a good day ahead.
All right, thank you very much. Like I said earlier, this has been a great conversation. Thank you, Nancy. Thank you, Amadou. Thank you, Jennifer. Thank you, Eve. Isabel has been fantastic, and then Jorge has been amazing. Like I said, to cap it all on what we've been doing over time, we've been doing this for the past 2.5 years, and it's something we want to continue to do. We want to continue to build our health sector accountability to be as strong as something that will be prepared and ready for any other thing that will hit us, not economically, not health-wise, but in all ramification. I want to say thank you for doing this with me. It has been amazing. I don't know I can host events. Jorge, I think we need to start this conversation of hosting event. And to our amazing listeners, thank you very much for joining. And please go through our reports. Let's see what you have. Let's see how we can collaborate. Let's see how we can engage, and let's do this for Africa so that we can be able to save one and save all. Thank you.
Thank you all. It was great. Great to hear from you. Bye.
Thank you, everybody. Take care. Bye.
Bye. Thank you, Isabella, George.
Bye.
Oh, God. Just
Bye, Eve.
Bye. Happy Open Gov.
Bye-bye.
Bye.